Cardiac electrophysiology is the study of the electrical signals within the heart. It forms a part where you understand how the various cells in the heart, various parts of the heart, they work together synchronously. It is the key to understanding why there might be some patients who feel bad with a slow heart rate, some patients who feel bad with a fast heart rate, and some patients who feel bad because they are out of rhythm. Under the umbrella of cardiology, it is the part of cardiology that deals entirely with the electrical signaling within the heart. Atrial fibrillation is an abnormal rhythm in the heart. The upper chamber of the heart is running at 400 beats per minute. Depending upon the conduction from the upper chamber to the lower chamber can run anywhere between 60 to 150 beats per minute. The common symptoms associated with atrial fibrillation are dizziness, palpitations, shortness of breath, fatigue, sleep disturbances, and breathlessness. Sometimes a dry cough can also be present in these patients. You may also get swelling of the feet, poor appetite, atypical chest pain, a feeling of heaviness, especially in the elderly age group. In very rare cases, you can get a decreased urine output. The only way to diagnose atrial fibrillation is to do an ECG. Unless you see the abnormal rhythm of atrial fibrillation on the ECG, you do not know it's atrial fibrillation. To understand the treatment options for someone diagnosed with atrial fibrillation, it is first important to know what atrial fibrillation can cause. Atrial fibrillation can be the cause of stroke. Atrial fibrillation can be the cause of heart failure. Atrial fibrillation can also impair your ability to do day-to-day activities. So the modalities to manage atrial fibrillation are dependent on what it causes and how we reverse those problems. So to prevent a stroke, patients with atrial fibrillation need to be on blood thinners. An atrial fibrillation that comes and goes will eventually develop into an atrial fibrillation that will be there all the time. If we develop the atrial fibrillation that is there all the time, the risk of stroke does not get completely decreased to the baseline as per the patient's age. So we have to also prevent the atrial fibrillation to pass from the stage of coming and going to the stage where it is present all the time. That is done with the help of medications and by a process called ablation. Medications work well in the initial stages of the disease. As the disease becomes more permanent, you have to use ablation to prevent both the progression of the disease as well as the recurrence of the disease itself. Once atrial fibrillation becomes permanent, the risk of stroke is very high, and as such, there are no good ways to escape out of that risk unless we revert the rhythm back to normal. Think of it like diabetes and hypertension, where intermittently you get spikes in blood sugar and blood pressure, for which we have to continuously keep doing something.